Hey guys, how are y'all? Today we're going to be talking about our skills, and our first one is initiating a peripheral venous access IV infusion. First of all, we need to verify that the IV solution that is ordered is correct with the MAR. Determine if this is appropriate for your patient and their condition. Clarify any inconsistencies. Check the patient's chart for allergies. Check the solution in the bag, see if there's any discoloration, any leaking, check the expiration date, and gather your supplies that you need to start the IV. Perform your hand hygiene, and gather any PPE that you might need. I think I already said that. Identify your patient. You can identify your patient by looking at their armband and asking them to state their name and date of birth. Provide privacy for your patient. You can do this by shutting the curtain or closing the door. Explain to your patient what you're doing and why. Ask your patient if they have any allergies, because it could be something different than what's listed on their chart, or their chart may not have anything and they may tell you they're allergic to something. Ask about allergies to meds, tape, skin antiseptics. If you're using a local anesthetic, explain why you're using that to your patient, and you can apply that local anesthetic to a couple of different sites that you may potentially use, and give that time to work before you stick. Prepare the IV solution and the administration set. Compare the IV label with the MAR, check the expiration date, and then you're going to scan the barcode on the container, on the IV bag. Next, you're going to compare the patient ID band with the MAR, label the solution container with the patient's name, the solution type, if there's any additives, and the date and time. Complete a time strip for the infusion and apply it to the container. Next, we're going to maintain aseptic technique and remove the administration set from the package. Label the tubing for when the next set needs to be changed. That'll differ from place to place, wherever you're at. You'll just have to know the guidelines. Close the roller clamp. You're going to invert the IV solution so that the spiky, or where you put the spike, is upside down. Remove that cap without touching that area, and then you're going to take the spike and take the cap off that spike, and then with a twisting and pushing motion, you're going to jab the spike into the bag while you're twisting it. Hang the IV on the pole. Squeeze the drip chamber till it's about halfway full. Open your IV clamp. Allow the fluid to flow until all the bubbles have disappeared. And then the whole tubing should be filled with fluid. And close your clamp. Then we are going to find our vein. We need to put the patient in the low Fowler's position. You're going to use either a towel or like a Chuck's pad, or I can't remember the proper name for those. Place that under the patient's arm. Open the short extension tubing. Attach the needleless connector or end cap. You're going to clean it with an alcohol wipe. Put a flush, I can't remember what that's called, the syringe with the normal saline on the end of it, and fill up the extension tubing with the normal saline, and then set that back down on the package. Then we're going to find our vein. We're going to palpate for our vein. You can use the veins in the arm, the forearm here, or the hand. But try to avoid the hand if you can, because a lot of patients say it's painful. So if the skin is visibly soiled, you can clean it with soap and water beforehand. If there's hair on the site, then you can clip it about 2 inches away from your insertion site. Tie your tourniquet about 4 to 6 inches above your site where you want to stick. Your tourniquet can't be on for longer than 2 minutes, I think. So if you find your vein and then you have to get your supplies ready, then you need to remove that, and then you'll have to redo it before you actually stick. So while your tourniquet's on there, have your patient make a fist, and you can have them open and close their fist to try to find the vein there that you need. After you find their vein, you need to clean it with the chlorhexidine, and it comes in like one of those little, there's like a plastic holder, and you squeeze it and you rub it with a friction motion up and down. And you need to let that dry completely. Don't wipe it or blot it, just let it air dry for 30 seconds. And then with your non-dominant hand, you need to hold the skin taut so that you can take your dominant hand and directly above the vein at about a 10 to 30 degree angle, you go directly in. And then once you're in, you should see a flashback of blood. And then you need to release your tourniquet. And then you need to, there'll be a safety device on the needle, and you have to release that safety device to pull your needle back in. And then make sure you're holding that catheter there so that it doesn't come out of your vein. And then you'll need to secure your catheter with a piece of tape. You need to make a loop. You'll have to put that cap back on, or with your flush, you'll need to flush it. Make sure there's no infiltration. Make sure there's no blood coming back out of it. And after you do that, you'll loop it, secure it, connect this device with the other device after you scrub it with alcohol pad, connect those, and then you'll take that tubing, loop it, secure it. You'll take the little alcohol cap things, place those on both of the insertion areas on your tubing, and then you will take a sterile dressing that's transparent and place it over your IV catheter. You don't want to make that too tight, because you could press down on that and then it wouldn't be in the vein where you need it to be. After you do that, you need to label that with name, date, time, the gauge of the catheter, your initials, and clean up your mess. You have to set your drip rate. If you're using a machine, you put it in there. But yeah, set your drip rate, and then you can clean up your mess, make sure the patient's all right, provide emotional support, all that good stuff. Perform hand hygiene again, and you need to come back in 30 minutes to make sure that there's still no infiltration and that there's no irritation, and make sure that the patient is okay. Thank you. Changing IV solution, container, and administration set. If you are using a pump or an electronic infusion device, pause it or put it on hold. Close your clamp closest to the drip chamber. If you're using gravity infusion, close your roller clamp on the administration set. Remove the entry site cap of the new IV solution. Remove your old bag from the pole. Sorry, I'm talking with my hands. remove the spike from the old bag, dispose of your old container. Without touching anything, you want to spike the new bag, hang it up on your pole. If you're using a pump, open the slide clamp, check your drip chamber of the administration set, verify your flow rate, and hit run or infuse. If you're using gravity, open your roller clamp slowly and count your drops and adjust your flow rate until your rate is achieved. To change the administration set, the tubing, you'll have your bag up there, close your roller clamp, undo that tubing, have your new tubing ready. You want to scrub each end with the alcohol and connect those. Then you want to make your loop, secure it, anchor it, and then replace your alcohol cap. I don't know the name of those things. Put those back on your entry sites, and then open your, what is the name of that? Open your clamp back up and place your patient back in the lowest position. Make sure they're comfortable, perform hand hygiene, and come back in 30 minutes to make sure that there's no infiltration or any problems.
Monitoring an IV site and infusion. This could change from policy, or the policy could change from facility to facility, but usually it should be done every hour. Go in to see your patient and check on their IV status. Look at the bag. Make sure that what's in the bag correlates with the drip rate, flow rate, and how much is left. Ask the patient if they're in any pain. Assess the site. Make sure there's no swelling, redness, edema. Feel the temperature of their skin. If it's cool, if there's pallor, that could indicate infiltration. Also check for signs of fluid overload. Ask if there's any bleeding, or see if there's any bleeding. That could lead to heart problems, respiration issues. Look for signs of infection. If they have chills, fever, if anything like that is occurring, then the IV will have to be taken out and moved to a different location. If you're using your IV pump, then check the flow rate, make sure it's still set to the right thing, and like I said, make sure it correlates with what's left in the bag, and check the sticker on the tubing and make sure that the time on that correlates. And if you're not using a pump, if you're using gravity, then count your drops, your drips, make sure that they are what they're supposed to be at, and adjust it accordingly. And make sure your patient's comfortable, and check on them in 30 minutes. Take your gloves off. Wash your hands.